Hey everybody, it's Trey Martinez, Fischer under the dome. Let me tell you, it's really cold out here. It's Thursday, it's about 40 degrees, but I'm pretty pumped up. I just got through with a press conference with Senator Kelly Hancock. He and I have been working on the issue of balanced billing for about 10 years. In 2009, he and I worked together in a bipartisan fashion that said, if you're a patient and you have healthcare coverage and you go into a clinic and that healthcare clinic is in your network, but for some reason you get a bill from a doctor who's not in your network, you should not be penalized for that. And as a matter of fact, we should set up a process where you can challenge that dispute and hopefully have insurance companies and doctors and patients figure out the solution. It's worked wonderfully. A number of states have adopted that proposal, and I'm very proud of that work. But what's been happening now is the issue has not gone away. So today, standing with Kelly Hancock from the Senate, we filed bipartisan legislation that said, you know what, we're going to get rid of balanced billing altogether and we're going to do it differently. If you go to a facility, you go to a hospital, you go to a clinic, and they tell you they take your insurance and your insurance is in the network with the clinic, but for some reason you see a doctor who's not part of your network, they don't even send you a bill for that. Under our proposal, that bill goes directly to the insurance company and directly to the doctor who provided the service and let them figure out what that reimbursement rate's going to be. Let's not put that on the back of the patient. If the patient's following the rules, if the patient has insurance, it is hard to get insurance in this state. So if you have it and you pay premiums, it ought to work for you. And when you walk into a clinic, especially in an emergency situation where you have no control over who's seeing you, if that doctor's not in your insurance network, it is not your fault. Let the insurance company, let the doctors work it out. I'm looking forward to this debate. I'm looking forward to making the bill better. The AARP supports this legislation. The Center for Public Policy Priorities supports this legislation. I'm willing to work with all stakeholders to make it better. But at the end of the day, no patient with insurance should have to suffer additional stress because they don't know the doctors that are treating them are not in network when they're in a network facility. Pretty simple stuff. Look forward to working with you, giving your thoughts, giving your feedback. What can you and I do together to change the direction of the state? Have a great weekend.